We're going live soon.
Are we good? All right. Thank you, Mr.
Okay, good.
Ryan. So, Keith, welcome back.
Yes, thank you.
We are back here at Hyperbaric Plus. I'm Paul Conradi, and hyperbaric.plus is our website. This is Keith Bishop, and he is prevailovercancer.com. And today we're going to talk about binders and cancer, and I'm probably going to push Mr. Keith a little bit into the mold world.
Yes, that's
I've
right,
had
yes.
I've had 3 clients come in this last week with anxiety. They never knew that it was probably from mold, and all 3 of them are getting, because they were in a mold environment, and no one's talked to them about that.
Right.
So maybe we can wake people up. But mold they've tied that to cancer big time.
That's right.
Binders, and that's how all this kind of plays together. So that's my little teaser. I hope you'll stay tuned until we get all the way into mold. But Keith, I'm going to let you tell us about binders and cancer.
Sure, yeah, binders and mold, but mold is a factor for cancer and anxiety and any type of a mental issue, because those mycotoxins from mold can get into the body and they are inflammatory. And there's quite a bit of research on inflammation in the brain. So anti-inflammatory type procedures and foods and prescription drugs, can help out with anxiety. So
why don't you tell people when we talk about mycotoxins and their damage, mycotoxins are
it's a byproduct from the mold. So the mold can be things that we eat. It could be our environment. It could be, I remember I had one client, she said that I think she was a house cleaner. If I get this story right, I talk to a lot of people every day, but she was actually a house cleaner, and she had some mycotoxin issues, but she was going into a house, and the house actually had toadstools growing in the shower. and so she was trying to clean that up, and she was being exposed to that all the time. So, I mean, there wasn't just toadstools. There's going to be other things growing in that environment. And so little tiny, I say toadstools, but, they could have been psychedelic. Who knows? I don't know.
People do something so simple that you mentioned that. People do not understand. They get out of the shower, they close the shower curtain.
Yeah.
Or if you got
the
a big
door.
glass door, they close the doors. And they don't ever let it ventilate.
Exactly.
I mean, I always tell people that we have this conversation, leave that all open. If a guest sees it, say, I'm trying to not have a mold issue.
Right.
And put a fan blowing into that shower and dry it out every time.
So, what we do is, we have a shower curtain. We have a big walk-in shower and a shower curtain. I will actually, after the shower, I'll kind of leave that open. So on each side, there's over a foot opening on each side, because I want the shower curtain to dry too. And then we leave a fan going in our bedroom that goes into the bath vanity area. And so there's always air blowing,
Circulate the air and get that air in that shower.
And that fan goes 24/7. Wintertime, summertime, it's always going to improve that circulation.
And if you're that housekeeper, tell that homeowner how important it is and say, hey, how do we get a fan in there?
That's right.
So I don't have to clean up mold.
That's right.
Because that's never going to be healthy. I don't care what kind it is, it's not healthy.
That's right. And so I will also do another one of my things is, my toothbrush. I don't have a toothbrush in a cup sitting out on the counter, so it doesn't air dry that way, but I have it in a drawer. And I realized that I closed that drawer. Now that wet toothbrush,
I do this. I thump into the sink and get all the moisture out, and then I leave it out to air dry on my sink. Yeah.
So now I leave that open, but also I use hydrogen peroxide. Okay, so I will actually disinfect my shower.
Clean your teeth.
I do the shower and spray the shower with hydrogen peroxide, and I spray the toothbrush, and I'll leave that drawer kind of open. So once again, we got this fan going. It's continuous movement, and so that's another source of mold. So mold can be from many different places, and mycotoxins, are byproducts of the mold. And they can damage the body. It create inflammation. If it's in the brain, now we have an increased risk of anxiety and depression. Even PTSD, can create inflammation in the brain. and there's studies showing that people that are suffering from PTSD and anxiety, they can take things like anti-inflammatory herbs like curcumin, and they do better. And I'm not saying cured, but they do better. And there's actually some science behind it in case studies in field situations. Even prisoners that have been captives, that have PTSD, the U.S. doctors are giving them curcumin to help them with their anxiety and help them with their problems that they've got. So yes, mycotoxins can be an issue. Binders, are an item that does help to trap some of those mycotoxins and mold and help eliminate those through the gut. But the problem is about the binders can have some other issues about taking those.
I've heard from a lot of my clients, you don't just get in here and hear somebody that's taking binders and go buy them.
Right. Yeah,
there's a process, because when you do genetic testing, there's another whole path there that keeps you from doing some binders or doing them the right way.
That's right.
So don't just, somebody tells you to go get on binders, there's a little more to it. And
that's right.
Really investigate deeply.
We're going to cover some of that today, but everybody is unique and different. So, matter of fact, we have a handout that I'm going to be looking at today. And so this, everybody at the table's got that handout, right? I think so. Okay, they've got the handout, and it's online. So I've got it 2 different places on my website. I've got a blog post about binders and cancer. You can go there. It's a free handout there on that blog post, and then also in the Learning Center, a free handout toward the bottom of that Learning Center. And Hyperbarics Plus usually has the handouts available on their website too. So I'm going to kind of refer to this, kind of make sure that I cover everything that we need to cover within the hour. If you have questions, submit those questions, and Ryan, our tech guy, is going to help us print off those questions later so we can answer those questions. So hyperbaric.plus and Prevail Over Cancer. Get your downloads for that, free downloads. So what are binders? And so binders are, literally physically, binders will trap things, in the intestines. So these are items that you take orally. They go into the stomach and the intestines, and they will bind up things. And so the most common thing that I see, I watch reality shows and veterinary shows. And so if a pet has eaten something that they're not supposed to, they're going to give them activated charcoal liquid. It's messy, but they'll force that down the animal, and it will bind up those chemicals, and so that they can pass that out and eliminate that. So that's going to be that's what a binder does, is that it physically attaches to a chemical that we want to get rid of. That's part of the problem, though, is that it doesn't know the difference between good stuff and bad stuff. So good stuff, vitamins, minerals, proteins, and fats, it will, if you take it close to those items or it mixes with those contents in your intestines, it's going to keep you from absorbing those nutrients. And so that's where I find out. I'm looking at my lab tests for my clients that have cancer or other health conditions, and I sometimes can say, well, you're low in several different things, and I have to go back and look at their list. What are they doing, with that? And so on social media, it's popular for people that are doing repurposed medications like ivermectin and fenbendazole to just automatically start taking a binder. And they believe that, according to anecdotal reports, people claiming that it helps out with the die-off of cancer cells. I can't find any support for that statement, and I can't find any science behind that. So I'm very cautious about it. I will use it for toxic metals, like after a PET scan or a MRI with contrast and toxic metals. Yes, I may use that for a couple of weeks, but not on a regular basis long term, because it doesn't know the difference between good and bad. So just to be taking a binder on a regular basis for months and months is wrong. And so you have to be targeted on how you do that. So binders can include activated charcoal, like I mentioned earlier. That activated means that it actually has been processed and activated so that it has more pores in it, so it can trap more chemicals. Matter of fact, I like to watch survival shows, and I like to camp and do a lot of things. And so, but charcoal is a great medium to filter water in an emergency. You can take charcoal from your fire and create a filter because it's going to trap the toxins, the parasites, and things in your water. You can
Put
also
it in a coffee filter or what? How do you do that?
Exactly. Exactly. You can put it in a coffee filter and pour your water through that to help reduce those the bacteria and that can amoebas and all kinds of things like that, parasites in the water to help reduce those. So in a filter, you can make a filter with sand and gravel and charcoal. But charcoal is the ultimate, detox type thing in that situation. So, but also inside the body, it does the same thing. It will trap, toxins and eliminate those, or the good things, and eliminate the good things. Bentonite clay and zeolite are some natural porous, means there's holes that, have space to trap these toxins. Clays that you can take also. So those are 2-3 things now that are binders. And then also we have fiber. And so there can be everything from soluble and insoluble fibers, psyllium, and there's a prescription drug that is cholestyramine. Questran, I believe, is a brand name many, many years ago when I was a pharmacist. And Questran also binds and traps actually bile salts in the intestines to help out with diarrhea. And so we can sometimes use these things to help out with particular health issues. But that cholestyramine, if you take it with a meal, it's going to bind up the food, and you're not going to absorb those nutrients. If you take the psyllium even, that fiber forms a gel. I don't know if you've ever done that or not before, but when I was in pharmacy school, I worked at a hospital, and one of the pharmacists said, "Keith, watch this." And they took a packet of psyllium that they gave patients, put it into a glass of water, let it sit there for 4 hours, turned it upside down, and it was like Jell-O on the counter. It kept the shape of that cup. Well, if you have medication or nutrients in the middle of that, you're not going to absorb those nutrients. And that's what he was teaching me, with that. So as 1977, I was exposed to that. So we have to be careful about the timing on these type items. And so I mentioned earlier, and I want to stress that in the cancer aspect, people are often, because it's in the support groups, the Facebook groups, if you take a repurposed medication, you need to take a binder. I don't agree with that. I strongly don't agree with that. So not automatically, if there are some gut reasons we can do that, but our body, it's our immune system's responsibility to get rid of those parasites and to get rid of the toxic metals out of the body, but they have very little actually impact on removing cancer out of the intestines per se. So it's not like the cancer cells are going to be leaking into the intestines. There is an exception to that: colon cancer, colorectal cancer. There could be some exceptions to that. Even gallbladder, and the tubes leading from the gallbladder into the digestive tract. There can be some cancers that might be an issue and would be worth doing, but it doesn't really work. I haven't seen the science behind it, and I've only seen people actually get into trouble taking binders without a purpose behind it and the right time about that. So the anecdotal, that means just people reporting and saying that it helps. Things says it helps out with brain fog and die-off symptoms. Once again, I haven't found, there is actually no science behind that, on helping out with that aspect. Now in mold, that's a different story, because mold, if we're getting mold in our food, in our environment, it can help trap the mold and the mycotoxins that are inside the intestines, yes. But as far as like taking it because of a repurposed medication, there's no science behind that. Let's see here. Okay, yep, covered that. GI complications. So complications can include constipation. So a binder is actually going to literally bind things up, and can create a binding situation if there's not enough fiber and enough liquid. And it can create a plug, a blockage in the intestines. And I've actually seen people with small intestine and large intestine blockages from taking binders. Usually it's more like taking like fiber type things, Metamucil, at a high dose with not enough liquid. And so it creates a plug. And matter of fact, I actually know some people that actually get diarrhea because they had a plug. and the plug was actually, there was such a back pressure and buildup, that plug was sitting there, and stool content was able to squish by and be eliminated out. So, but the root cause was actually a plug, a physical hard plug inside the intestines. So it can create nutrient deficiency absorption. So your vitamins and minerals, so zinc, minerals, zinc and calcium and magnesium and phosphorus and potassium. If you take these things too close to your meals, they're going to bind those up and physically bind them up, tie them up, and eliminate them out. You're not going to absorb those if they're bound up. So you have to separate this, and a binder should be no closer than 1 hour before or 2 hours after a meal. So it's more like an empty stomach. But a lot of people with cancer are trying to do other things empty stomach between meals. So it becomes quite a challenge to try to squeeze that in between. Once again, not within an hour of taking food or supplements, or an hour before or 2 hours after a meal, for that. So, matter of fact, it can also not only bind up vitamins and minerals, but it can also bind up the other compounds like active ingredients that we're trying to use, like curcumin and quercetin and EGCG. So any type of a chemical that we're trying to have an impact on cancer, if taken too close, it's going to bind that up. Okay, I'm going to turn the page here, make sure I cover enough information. So by the way, submit your questions. We are talking about mycotoxins, it's going to be a little bit about mycotoxins. Yes, if you have mycotoxin questions, yes, submit that. But about binders specifically and primarily in relationship to cancer. And so I've got a little information about fenbendazole and ivermectin on this handout about how it works. So fenbendazole does help to decrease microtubule, that's the division of cancer cells, and then also helps keep the cancer cells to be able to use glucose and maybe even glutamine. And then ivermectin helps to help kill cancer cells and helps the immune system to respond appropriately, and may help out with fat absorption and use by cancer cells. So the one time that I will use binders is after a PET scan or a CT scan or an MRI, where there are also other chemicals involved that are enhancing agents. So often there's toxic metals, and some of those toxic metals could be iodine. Matter of fact, I was amazed at how much iodine can be in those treatments. I was not aware of that. So, it's more like 100 milligrams per milliliter in that solution.
Huge.
That's a huge amount. No wonder some people have a side effect and think that they're allergic to iodine, but they were getting a humongous dose of iodine in that contrast medium. So yes, so and having that ingredient in the intestines, could help pull some of that through the blood vessels that are in the lining of the intestines and trap some of that and help eliminate that. Once again, that's a short-term type thing.
I have a lot of clients that just recently, Dr. Amon's office has been sending a lot of people to do hyperbarics. And so he does a SPECT imaging, which is a brain SPECT imaging, and nuclear MRI, meaning they put contrast so they can see blood flow.
Right.
Is there something that inhibits you from doing binders, getting past the blood-brain barrier? Is there any binders that go to search that out, or do you need to let it come back into the body?
It does have to kind of, so those binders are not absorbed into the body. And so they do not cross into the body almost not well at all.
Okay.
Now, I will use another item actually for CTs and X-rays and MRI repairs, alpha lipoic acid, an antioxidant, or glutathione to help repair the body, but actually just takes time, for that to get out. Now, there are other chelators that are absorbed. And so we're talking about, and that was going to be the next thing, is going to be EDTA and DTPA, but these are prescription drugs now that physically are absorbed and bind up the toxic metals in the body, and then helps to flush them out through the kidneys. So you have to have enough fluids on that. Most of those actually are prescription items in most current countries, because they can be kind of damaging. And so because even inside the body, they don't know the difference between the toxic metal, mercury, lead, arsenic, palladium, iodine excess, or magnesium and calcium and phosphorus and potassium. And so it doesn't know the difference between those. So we do have to be very careful about that, but those do work, but it takes time to kind of get that out of the body. Okay. On that. So yes, that's a common thing to use those scans. And so I don't tell people not to do those scans. Sometimes we do need that information, but our body can get rid of that, and we can use binders for that. There's also tests available, hair tests available, urine tests that also will measure those toxic metals. And so we know if those type things are a problem or not, that contrast agent. I'm not sure what he uses for that. It's a great test. And so we were talking about that a little while ago too. So it's a great test to evaluate where part of the brain is active and maybe inflamed and on fire. And it guides some information as to what type of a therapy can be done. Sometimes just a counseling is not enough. We need to do some other physical things to help out with that. So here's some kind of safer ways to support your body after imaging scans. So instead of using binders, you can, after these PET scans and CTs and MRIs with contrast, drink plenty of water, drink plenty of fluids. Matter of fact, you don't want to be taking those items before you do the scan because it's going to bind up stuff, to a certain extent. So we don't necessarily want to be doing those binders. Matter of fact, I have a protocol about avoiding even, supplements that can keep cancer cells from growing for a day or two before a scan. Because if they're doing a PET scan, which is a radioactive sugar solution, we want those cancer cells active and taking that active solution in. So I often recommend taking a break for a couple of days before a scan on that. And matter of fact, even fasting before the scan. There's studies showing that before a PET scan, not eating for 24 hours probably enhances the effectiveness of the scan. With that. So drink plenty of fluids, increase your antioxidant food intake, dark colored fruits and vegetables, and or even supplements, vitamin C, I mentioned earlier alpha lipoic acid and glutathione intentionally for a very short time period to help repair the body from that X-ray. So X-rays and PET scans literally damage the body, and so they do create physical damage. And antioxidants repair cells. But if a person is going through radiation therapy for cancer, we have to be careful about doing high dose oral antioxidants like alpha lipoic acid. Have to be careful about that. That might be a problem. But glutathione and NAC, that's another one. I love NAC. I use it for a lot of different things, but not at the same time as an X-ray or as a CT. Because we don't want to interfere with that process. So gentle movement. So we got to get the lymphatic system going. We need to exercise and be active and or gentle massage, to get the lymphatic system going so that those chemicals, our detox system, can help mobilize that and get rid of those toxic metals.
How about a vibration plate?
But that'd be another great option.
Well, I tell you, everybody that's using a vibration plate in red light therapy, they're just they come out saying, I'm happy.
Yeah.
Good.
The red light, exactly. The red light, NIR, and then the vibration is a type of exercise perfect for bone density.
Right.
I strongly recommend that. So bones are living tissue, and if we do the right things, we get the right nutrients into the body, make sure we're absorbing nutrients, and improve circulation, like with hyperbaric, and then we have red light improving the mitochondrial function and circulation, and then exercise like a vibration plate, perfect combination for bone density.
It's amazing how many people are using the vibration plate and their joint health improves. Where they have joint pain, it's like working out that joint because you're vibrating it.
Yes.
I mean, I'm just really shocked how many people are getting relief.
Well, the joint, actually, that cartilage that we need to grow thicker and to rehydrate and grow comes from the bone. So it's the bone is actually the problem. And, in that joint. Now, there may be a physical injury that occurred, and I've had problems with that, but if there's a physical injury in that joint, that cartilage could be damaged, and if it goes back and the cartilage is torn off of the joint, that's not going to regrow. But the rest of the cartilage actually comes from the end of the bone. So bone life and energy and growth grows that cartilage.
For all the exercise equipment that's out there and wellness components that are out there, to spend $110 on the vibration plate I've got, that's what everybody that's come in and used it, they go, why don't I have one of these at home?
Right.
Well, I can watch TV while I'm exercising.
Yeah,
And
exactly.
it's just a no-brainer to,
And,
so,
and matter of fact, you even have to start low and slow. I mean,
Yeah.
start just a few minutes, a
Yeah.
couple of minutes at a time, and gradually increase that, because that is that's shock
what are you
to the
talking
body.
about?
That's right,
Yeah.
exactly. That's shock to the body.
Yeah.
But that's what it takes.
Yeah.
That exercise
Yeah.
and that activity to
Crazy.
stress the body some. So very important. And then typically I only use these binders short term, and specifically away from other items, and away from food and supplements and prescription drugs, to keep from binding those up.
So I wake up in the morning and I take my vitamin pack that I take in the morning, and I want to bind things and eliminate them. When would I take a binder? Because I'm going to take something of the evening as well before I go to bed. Those are the 2 times I take the things that I supplement. So when in that morning and evening, when would you take a binder?
So it would have to be like 2 hours after your supplements, or an hour before. It depends on your nighttime. If you took those, it needs to be either an hour before or 2 hours after your supplements. So not within those 2 time frames. So then we have to look at another time of the day. So now,
Does a binder work during the night? Is that
That would be an option.
Exposed for a longer amount of time that I
That
get more benefit?
I don't know if it would work better or not, because it depends on how long it's going to be in the intestines and when you have a bowel movement. So, but nighttime would be a definite option. So for example, you could take your nighttime evening pills
At 5, and
at
then a
5,
binder at
eat
7
dinner,
or 8.
eat dinner at 6, and then take a binder at 8.
Okay.
And go to sleep. But then once again, you can't take anything else around that at the same time, because it would bind it up and would not be absorbed. Whatever you take would be locked up inside that binder and be eliminated out. So be sure and talk to your healthcare team about this. Actually, most doctors don't know much information about it unless they're what we call a functional medicine doctor. That's what we call them in the United States. They're very familiar with binders. They will use binders, in these scenarios, but they're going to coach you on the right time for that. So if you have questions, be sure and submit those. And Ryan's going to help us with that. He'll print those off for us if we have any questions. And so, do you have any other thoughts or questions?
Oh, I've been hammering you.
That's great,
When
yeah.
it comes on, I think I ask it right then before I forget. So are you done? Have you covered your topics?
One more. Oh, there's another part.
Yeah.
Just consult with your oncology team, integrative team, avoid near meals, monitor. So do tests and evaluate your levels. So, for example, I do a nutrition physical, and it's a very basic thing for most of my clients at the very beginning to see if they're in an acid state. So if your saliva and urine is acidic and you want to do binders, you've got to be extremely careful, because if you're acidic, that means you're already low in minerals. If you add more binders in, you become more acidic. Cancer cells thrive in that acid situation, and they're going to grow. They're going to create new blood vessels, to get more nutrients, and they're going to thrive in that situation. The cancer cells actually make acid. One of those that we measure is called LD or LDH. That's a blood test, a $20 blood test available in most states in the United States without a doctor's order. And so I use that as one of those things to monitor that. But if you're already in an acid state, if your zinc is low, you're in an acid state, your iodine's low, adding a binder on is just going to make all of that worse. So we need to be very careful about that. There are also blood tests available for copper and zinc, iodine and selenium, some basic nutrients and toxic metals. There's also a hair test available. Both, either a hair test for toxic metals and minerals is about $150. A urine test, combination urine and blood spot test, is $151 or so also. So I have links on my website on the resources page for that. So, and then besides monitoring, do not rely on Facebook groups saying you should take a binder. You need to think through that process. Do not just follow what everybody's doing, it may not be appropriate.
Yeah, that's important. I mean, we tend to get in a group and follow, hey, they're having success, so
Right.
they may not be having
So, and
How
we
do
do
they-
need to be careful about that.
Yeah.
So I know a gentleman that has a prostate cancer support group. Don Wright is his name. He's from here in Oklahoma City. And he actually had a Joe Tippins person or a Joe Tippins account that wanted to join his prostate cancer group. And so he said, Keith, does this look legitimate? It was not a legitimate Joe Tippins
I've never
group.
heard of a Joe Tippins account.
Yeah, well, there are Joe Tippins accounts.
I didn't know that.
Most of them are fraud. Okay.
Oh, I get it. Yeah, because
Okay.
they've hijacked his
They
website.
hijacked his
big time.
website, and
Yeah.
they've got his photograph with his
Yeah,
grandson that
they're
he's
out
holding,
promoting all this stuff and selling product.
and
yeah.
and then not delivering.
Yeah, yeah.
Taking
That's crazy.
$600 to $800 for product and then not delivering.
Joe has never done
He doesn't sell anything.
He's never done anything to cash in
Exactly.
on
He
his
does
success.
He does not sell anything. He does have a website and he does have a link to some things, yes, but he does not sell anything. So if you have a website that's trying to get you to buy something, from Joe
protocol.
Tippins, don't do it. So you will lose money on that. So anyway, so yes, but be careful about those support groups because there are people that maybe they have had personal experience doing something and some success, but each person is different. So we do need to be careful about that. So in our table, any questions? Y'all have questions? I did such a good job. You just don't need any help, all right? Oh, yes.
Okay, you mentioned earlier on about mold and having any mold in the house could be detrimental. What about blue cheese?
Okay, yes. So besides mold in the house can be a problem, definitely. But we're all exposed to mold. And we, as a matter of fact, it's not common for a person to have no mold in a test, in their mycotoxin test. So most people do have some, usually it's like a low level. And so, and in a family, I've actually do know people where one person is testing high in mycotoxins, the damaging chemical from mold, and then the rest of the family is perfectly fine. They're not having any symptoms and they don't test positive, but some people just genetically have a difficult time getting rid of that. So what about blue cheese and other foods? And so that is a potential issue. And so there are certain types of mold. So some of those, and I'm not sure if that's a penicillium type mold. I can't remember if that's what it is in the blue cheese or not, but there are potential issues, and I'm not expert on the blue cheese. And so I do eat blue cheese occasionally, yes. As a matter of fact, actually, a lot of cheeses have some mold in them.
Made from mold.
Mold and bacteria, yes. And so but not all molds are going to be pathogenic or a damaging problem.
Okay, that's what I wanted to.
Yes. So certain ones are worse than others. So, and I'm not sure about blue cheese, if that is an issue or not. And our person that helps us with those research while we're online is not here today.
Yeah.
Josh is not here.
Send us a note if you figure that one out.
Yeah, send us a message, Josh, if by chance you're watching. So,
Well, I mean, I've got a lot of mold clients here, and so they're taking the Petri dishes and doing a self-test just to kind of understand if there's a mold population in their house. So they'll open a Petri dish for an hour, and it'll
Yep.
collect
Oh,
air
yeah.
sample, and then they'll close it up, wait 4 days in a dark closet, and is there mold? Well, all of them have mold. There's spores that are floating around all the time, so they're all going to have some mold. But when it gets so moldy that it pushes the top off of that Petri dish,
wow.
that's a serious mold problem, and that's when you take the next step and then get an inspector and do all that
Get a
stuff.
professional.
But a lot of people just to, understand, just put a Petri dish, they cost like $3 or $4 each. Put them around the house where you got water, the bathroom, the kitchen, and anything that may have had water damage in the past. I tell you what, chimneys are everyone in here has got chimney issues.
Yeah.
And there's water around that chimney. And so put these dishes and see if you have a high concentration of mold.
Right.
Then you go to the next level. But even when you put those Petri dishes out, you're going to have some mold because we're a mold
That's right.
world,
There is
especially
stuff.
in Oklahoma.
There is stuff in the air, so it's just going to be around. That is correct, on that. So, let me kind of glance at time, see how we're doing. Okay. So matter of fact, last night we had rain, and so there's going to be some rain that's going to be coming down the chimney, from that rain. So we had over 1.5 inches of rain last night and this morning. So it's definitely going to be coming in, but if there's enough circulation, so that's another, actually, fan. We have that ceiling fan in our living room going continuously.
Well, I'm talking about the flashing
And the flashing around the
chimney
house,
that
yeah,
it
around
gets
the
into
yes.
the attic. I mean, that's where, and people don't go in their attic
We
to
don't
look
check
at their
that out.
chimney,
Yeah.
and that's where it continues
That's for
to
the
grow.
purpose of circulation and ventilation to help dry that out. And that's going to happen, but it's got to dry out. But then we have to evaluate the person and see if there's problems. So, on that. So, okay, question. So, how do I talk to my oncologist about using repurposed drugs without them shutting me down or dismissing me? Or doctors, they'll call it firing the patient. And so, actually, I have a webinar, and I talk about that, a free workshop. It's about a 25-minute workshop. You can go to my website. At the top of the website, I have a bar about that, about a free, it's called the Empowered Cancer Workshop. And I do talk about that, but one of the things what you do is, number one, you don't be demanding of the doctor. You want to respect them and actually encourage them and thank them for what they do, acknowledge their training, and just say, a lot of people are doing, natural things or alternative, integrative type things. What do you think about that? And allow them to kind of, talk through it, and they may just say, say something about it, and you get an idea about if you can approach them further or not. Rarely does a doctor just automatically, if you ask an open-ended question, and not saying, can I do that, but just more, what do you think about that? They rarely will say, you better not do it or I'll fire you, okay? But you have an idea if you want to proceed or not with that question. And so if you want to do that. So I'm not saying, or
with that doctor.
Or with that doctor,
I mean,
switch gears.
Yeah, nail that down early on.
Exactly.
And have an open mind. I mean, we're not.
There are and matter of fact, in the past 2 years, it is changing. Yeah. It is amazing how it's changing. And it's actually rare now for me to come across a person. Actually, I had a person yesterday that was in Canada that has a problem with that, okay? And so, but in the United States, I have not heard as many cases about that, about actually a patient being fired because they were doing integrative type things. But so check out that free workshop, about 25-minute long, and it will also give you a couple other little tips about how to work with that doctor, encourage the doctor, and let the doctor know that you want them, you need them, and you want to come back and see them. That's how they make their money. That's their hook for their business, is you coming back to see them. So,
well, you don't want to give up the insurance component there that you can do all your testing.
Yes, take advantage of those. Exactly.
So
take advantage.
Don't fire him and walk out if some of these doctors are wanting to follow your progress to see how you do with it.
Yes, and exactly. And we do want to work with those doctors that are starting to get open to it. They need to learn.
Yeah. And you need that path for all the testing your insurance is going to pay for, even if you're going off the
and so you've got to have that doctor. And so, and these persons that actually I had 2 people in Canada yesterday, and so I was encouraging them, one of them to actually get an alternative practitioner, and the other one to use the one that she's already got to do the blood test, to take advantage of the benefits.
Right.
Instead of paying cash for some of these tests. So they can get those tests from that practitioner. So which is the best and healthy way to clean mold? And so, it's best actually, if there's a mold issue, to actually use a professional to guide that. But I personally have used actually a high grade, high dose of hydrogen peroxide. And so, as a matter of fact, during viral pandemics, in a pharmacy, we actually used a high dose fog that was hydrogen peroxide, a high dose of hydrogen peroxide. Hydrogen peroxide kills mold, bacteria, fungus, and viruses. And so it does take time, so it's not instant. But using 3% hydrogen peroxide, a medical grade, if you want to call it that, barely strong enough. Not quite strong enough for a remediation.
Bleach is a no-no.
Yeah, bleach and the toxic chemicals that come from that is a problem.
Yeah.
So, but hydrogen peroxide is my favorite. There are some solutions, but most of those solutions are also, you have to be careful about what those ingredients are and what those chemicals are, because they're there forever. But a lot of them do use some hydrogen peroxide, type things on that. So I can't leave my moldy home yet. What are the first 2 and 3 steps I should take immediately? So, well, you've got to start treating, and ventilating and drying that out, and to help, take care of that. And here in the United States, we're starting to go into wintertime. We have to still open up the house. We have to let fresh air in, but we have to use the heat system or the air conditioning system. Both of those actually dehydrate the air.
So dehydrators in the summertime
dehydrator.
are in Oklahoma. In the summertime, our interior humidity can stay at 60, 65%.
Easy.
It's got to be below 50, and a lot of people are saying below 40. So to use a dehumidifier, in a house is one,
dehumidifier.
and then there's some real good HEPA air
Right.
air filters
Yeah.
that are standalone. You can run in a room.
And those will filter the spores.
Yeah.
So
So at least where you're sleeping or where you're spending a good amount of your time in the house,
Right.
have one in that room.
So, matter of fact, in the compounding pharmacy, we used several different dehumidifiers, and it was amazing. In one day, that dehumidifier rather, would get over a gallon of water out of the air.
Right.
Each one of those, over a gallon a day out of the air, and that's with an air conditioner going all the time. So it's amazing, how much water that can be in the air. And actually, they're doing that in compounding pharmacy type situations to reduce the mold, because there's stuff in the air, so we have to dehydrate that to keep it from growing, and because they don't want that in the medications.
And contaminating the medication.
Exactly,
yeah.
contaminating the medications type thing. So the hardest part of mold is I have been told to move to a new space, but I'm exhausted from mold and cancer. And it causes decision-making issues. It sure does. That's a tough situation. But sometimes we do have to move. If there's a situation and it's bad and it's creating health problems, if it can't be taken care of, we've got to move to a different situation.
Look in the Bible.
Yeah. Oh, all kinds of rules.
Oh, yeah.
And
If you have mold,
procedures.
you can try cleaning it once. If that doesn't eradicate it, you burn your house down.
Exactly. Tear it down, and
'Cause it's not good for
the
you.
priest had to approve that and inspect that. And so, yes, it is such a major concern. That's right. Recommend brands of binders that I like. And so there are probably, literally there are hundreds, probably thousands of different brands out there. I do use one. It's called, I think it's called Charcoal Plus, but it's by Designs for Health. It's actually a combination of activated charcoal, zeolite, and chlorella, which is a algae type item. And so that's one that I'll use as a capsule, but there are hundreds. It's not the only one, but I do have that on my website.
My biological dentist did testing on me and scared me. I saw the test. She didn't have to scare me. I read it.
What'd you test?
She tested oral. She tested my saliva first. There's 5 bacteria that you do not want in your mouth, and one of mine were very high. And it was the one that is a prerequisite to colon cancer.
Okay.
And so it was sky high. I didn't even have evidence of the other 4. So I went to work on that one. And then I got a heavy metal load. She did a bioscan on me. And I went in to have some teeth where I want to remove my root canals. And she goes, "Paul, we can't do that until you're healthy." I'm like, "Well, I'm not sick. I'm pretty healthy." And she goes, "Oh, no, you're not." So she put me on, she's a real big Cellcore. So she put me on 3 or 4 Cellcore products, and in 90 days, all my numbers changed dramatically.
Okay.
And I'm not done yet. We're not looking at my root canals yet.
So who was that?
That was up in Haymaker, Dr. Haymaker in
Okay.
Hennessy.
Okay.
And I know you've got somebody here locally.
Yeah, so we can tag a couple of people. So
Go ahead.
Yeah, so Dr. Debbie Osmond, she does that oral genetic test.
Right.
In a what's called a 3D a cone X-ray to get deep and look in those root
See
canals.
if you have cavitation
Exactly.
or any kind of bacteria in a cavitation.
Exactly. So there's all kinds of biological dentists that are available.
If you're dealing with a chronic health issue, I'm telling you how many of my clients went to a biological, not their dentist, a biological dentist.
Right.
And they identified, and if you've had any kind of cavitations that are infected, that you have infection in, that's detrimental to your health.
That's right,
And
yeah.
I know you and I have had that conversation. many
Cavitation is a pocket, a
even,
hole.
Even your wisdom teeth, when they were removed, if they didn't get all the ligaments and tendons out of that cavitation that was left, then they seal it up, and then 50 years later, you're
Right.
feeling bad. There's a lot of videos on TV where they puncture that area, and it's incredible what comes out when they poke a hole in it.
Yeah, and so that lymphatic system
Yeah.
drains down.
And eventually, it's going to overwhelm your immune system, and it starts.
Right.
You get to that threshold, you're not going to get any better until you deal with that. So,
Okay, and so can mold exposure make cancer treatments less effective or harder to tolerate? So yes, and so mold exposure, can create inflammation. So those mycotoxins are inflammatory, and it depends on kind of where it settles in, but it can settle in the brain. So now we're talking about anxiety, depression, and even making PTSD type things worse, to inflammation anywhere in the body. Any organ where that settles in is going to be an inflamed area, and that inflammation is a driver of cancer. So yes, that is a major issue.
I'm surprised how many questions we're getting on mold when our topic was cancer.
That's okay.
They go hand in hand.
Exactly, it does, yeah.
Maybe the reason I said that, maybe we're coming out on top of the hour, but maybe we do a mold. Have we ever done mold?
I think we have, but we can do it again.
Well, I'll tell you, I mean, as many questions
I know,
as we
yeah,
got
a lot
on
of
mold.
definitely.
And there's definitely a connection to cancer.
Yes.
All my clients that are, I'll say a lot of my clients that are dealing with cancer, they can go back and find a mold issue, and they have mycotoxins when they test. So you can't just ignore it.
Right.
Don't guess.
Assess.
There you go.
Okay,
that's
right,
Keith's
that's right.
deal. So
Yes. One last question I want to answer. So a person had a doctor said NAC could be used by cancer cells to grow. Is that correct? Well, I wouldn't say to really grow, but what happens is that NAC is an antioxidant that turns into cysteine. Cysteine is an amino acid that works as an antioxidant that does two things. It donates electrons and it repairs cells, and it can repair cancer cells that have been damaged, and it increases glutathione levels. And glutathione is the ultimate master antioxidant that our body has. Well, there are research studies showing that NAC will decrease the effectiveness of chemotherapy, and it will decrease the effectiveness of radiation therapy. So NAC, although it's one of my favorite things because it's great for thinning out congestion, maybe getting rid of some spike issues, various different things like that. Matter of fact, my wife actually takes it every single day as a cancer prevention. So it doesn't really cause cancer to grow, but as a cancer prevention, yes, it's great. But during treatments, it may be a problem. So that's going to be the problem. So not with the treatment per se. I may use it at other times.
Well, Keith, we got a lot of questions
got a lot
here
more
you
questions.
weren't able to get to. So thank you for sending those questions in. And maybe you're driving the boat to where we go to mold next week. I don't know.
Well, next week is Thanksgiving.
Oh, yeah, we
In
won't
the
be
US,
here.
In the U.S., we're doing Thanksgiving.
Yeah, we
next
won't
week.
be here next week. So the week after that,
Week
maybe
after that.
And I'll get all my mold people around, and we'll get
Okay,
some questions
let's do
and
the-
kind
let's
of come
do
up
mold.
with a game plan. So Keith with prevailovercancer.com, great resource. Y'all haven't been to his website. There's so much information there that, especially if you're dealing with cancer. I mean, there's so many things about nutrition. How many people come in here and they've never been talked to with their doctor
Right. Oh, yeah.
about nutrition? I
Just
throw
doesn't
your
happen.
name out there and they call you and they go, man, I called Keith and all he wanted to talk about was food.
We've got to start with that.
And I'm like, well, yeah,
It's
I mean,
the number one
let-
thing. But I mean, other things are important.
yeah,
Yes.
let food be thy medicine. There's a lot that you can do just with your diet. So
So
it's
that's
really
why
an important.
that's why I switched gears from pharmacy because I was seeing drugs weren't working good enough, but it was food and targeted supplements, were the key to driving long-term changes.
So he's a wealth of information. Hope you'll join us again next week. I'm Paul with Hyperbaric.plus. Come see us, jump in the chamber, and I think we'll close with that. Keith,
Yes, very
thank you
good. Yeah,
again.
thank you.
All right. I know you like to close with that.
Yeah.
All right. Thank you all.